Good evening, this is Dr. Do again. This video is a quarantine special, video number 35. Today I am thinking to talk about the proteinuria because it could be very subtle until you have lost a lot of protein and body start to respond with the swelling or edema. Then you realize and you went to the physician and test that you have the protein loss from the kidney. So any emergency, usually if the edema is bothering you from kidney cause, probably not warrant like the heart attack caused the edema. That's a different story, but still, the earlier the better. Call your physician. If your physician is not available, then see the emergency. But usually, because this protein loss caused the edema is not 1 day or 2 days. It's a chronic process if from the kidney. If from the kidney you lost protein, it's not like 1 day you lost protein, you cause edema. Usually it's a gradual process. So you see your physician. So before I talk detail about the proteinuria, let's talk about the kidney structure. There's the glomerulus. I talked about that's the major function unit of the kidney. I mentioned it before, and there's in this glomerula with the it's wrapped. It's a ball of capillary. So the filter membrane structure, which formed by the endothelial cells and the podocytes and also the basement membrane, 3 layers to secure protein should not leak out. Usually only to dipeptides or to small molecule or sodium or water or ions can pass through. But this protein, since it's large enough, the slit between the filter membrane is small, so protein cannot pass. If any of these 3 layers had a problem, either the glomerule, the blood vessel, or capillary endothelial cells, or the basement membrane, or the podocytes has a problem. So any of this structure has a problem, so leading to the protein leaking out. It's a symptomatic. Unless the disease caused by the infection, you feel the pain. Otherwise, symptomatic, you cannot feel it until protein kept loss, and then the body has lose weight and loss of protein cause oncotic pressure decreased, so has edema. If that's the case, then usually you have to see a physician and to find out the problem. So what kind of cause for this proteinuria? Of course, the most common ones, you have other diseases. You probably know if diabetes is the one. I always mention that. If you are diagnosed as diabetes, I'm sure your physician already told you diabetic retinopathy. It's the end stage because the blood sugar impaired this function of the kidney, cause the kidney ischemia, and then this filter membrane is damaged. The barrier structure is damaged, so then the protein is leaking. And any other causes like the autoimmune disease, there's some antibodies recognize this basement membrane as a foreign structure, foreign tissue, so the antibody attack this filter structure. So that's the case. If that's the case, protein also can leak out. Also, there's some autoimmune through other mechanism, the antigen, antibody, and the complement form a complex somehow deposit on that membrane. So also cause the damage, the protein leaking out. So all of these nephropathy can cause protein leaking out to lose the protein. The proteinuria is how to manage it, how to diagnose it. Usually, like I said, you feel tired because you lost protein, and you have the edema, and you visit the physician. The physician do the urine dip. Okay, fine. There's a protein there. There's a value. If you're familiar with this urine dip, a little strip type of paper, and then dip in, and you see whether there's a protein or not. So if that's the case, your physician will do further workup, find out what is the cause for the the proteinuria, a symptomatic proteinuria without any disease such as diabetes or high blood pressure. Talking about this high blood pressure, I did not mention, I should mention it. The most common cause diabetes and hypertensive retinopathy. Because hypertension causes the kidney disease can cause hypertension. Hypertension itself also can cause kidney damage, to damage the kidney is undergoing ischemic. The filter membrane structure is damaged. Same, different mechanism, but the idea is the same. So then the membrane is damaged, protein leaking out. So that's the two common cause for the proteinuria. Other causes, like I said, lupus, or even some other systemic autoimmune disease can cause this. A lot of chronic disease can damage the kidney, cause chronic kidney disease, cause this proteinuria. If it's late stage, then you already know it. You visit your physician, is diagnosed. The early stage is challenging because it's, like I said, it's symptomatic. Usually, there's no obvious, unless you have family history, or you were diagnosed as a systemic disease. Your physician, like for example, diabetes, hypertension, or lupus, your physician told you you have this, and they monitor your kidney function regularly. If you do not have any of those systemic disease, it just happened by itself, like a nephrotic syndrome, and some of the disease could occur in not have to be elderly, any age. So that is the challenging for the physician or for yourself to notice, to know that you have or doesn't have the proteinuria, have or do not have the nephrotic syndrome. There are multiple causes, multiple forms, and the take-home message is if you feel tired, not just without obvious cause, you just feel like no energy, not from the mood or depression, not from any over fatigue, over exercised, or any physical activity cause you fatigue. It could be, and no anemia. You do not look pale or any of those. But if just feel tired, especially toward 50 or about 50 years old, and see, just check it out. Make sure, just one simple urine dip probably can reveal this serious problem. The take-home message is, if you, without cause, you feel, without psychological, physical cause, you feel tired, see your physician to work out, to check it out, to see whether there's any causative problem. If no, then you feel better, and a physician also will continue to monitor you, just in case it's some early stage, and later on to regularly follow up your progression of the whether you feel better or not. So that is the video for today about the proteinuria. It could be very subtle, so just a little remind for those people may or may not know. But thank you for watching. I will see you next time.